Okay, so what we'll do this week is to talk about this last section of the UCAT test, which I think we introduced briefly last time, but just to remind you that situational judgment is very different than the other three sections. So all the others are essentially kind of supposedly testing your intellectual ability. In reality, testing how quickly you can get through questions more than anything else, and therefore how much practice you've done. But this one is different because it's not really about intellectual ability, it's about how you think about tricky situations and how you might respond to them, what you think is important in deciding how you should respond to them. And what they're looking for is how closely you agree with them. Okay, so this is about training yourself to think in the same kind of way that the people who set the questions do, so that you'll agree with them and therefore you'll get a high mark for this section. So they'll give you some kind of short scenario just summarized in sort of 4 or 5 lines or something. And usually in UCAT, you have to put yourself in the shoes of a medical student or sometimes a junior doctor. Occasionally, it might not have to do with medicine, but usually it has to do with that. Or again, it could be a dental student or a junior dentist. And you have to put yourself in that person's shoes and decide how you would respond. So what would you do? What would you say? Well, sometimes they don't actually ask you how you would respond. They sort of say, well, is this issue important? Is that issue important when you're deciding how to respond? So that's essentially what you're to do. And the importance of it is twofold. The immediate reason we're looking at it is because it's a UCAT thing. But it's also a really good introduction to one of the kinds of questions which is going to loom large when you get to interview. And again, that's equally true for medicine and dentistry. They ask you lots of questions like this. You know, what would you do in this situation? And there is sort of a difference there in that for UCAT, because it's a multiple choice thing, you have to come to a clear answer and say, right, well, this is what I think. In an interview, what you need to highlight is that these are difficult questions and that almost always, whatever decision you come to, it's not going to feel perfect from all points of view. You know, like most things in life, whatever course of action you take, it's not the ideal thing from one point of view or another. And they want you to show that you're sensitive to all of those things in an interview. So although we're talking about the same kind of scenarios, the way you deal with them is sort of different in the two things. So we'll focus on it from a UCAT perspective today, but in later weeks we'll look at some interview kind of questions. So you can see from that 69 questions in 26 minutes, so it's very fast, although you get 4 or 5 questions on each scenario, so it's not like you've got to read 69 separate scenarios to do all of that. Even so, it is fast, and they say that the reason they do that is that they want you just to write down immediately what you think. They don't want you to spend a lot of time kind of puzzling out what the right answer might be. But as I say, in reality, what you don't want to do is to just put down what you immediately think. What you want to do is to train yourself to think like they do and then put down rapidly what you think. And that's going to be the skill of this section. So because it's not, you know, it's a bit subjective, it's not clearly right or wrong in the way, say, the maths section was, they don't score it in the same way. They do actually, for their own benefit, give you a numerical score. So what they will do is they'll give you a certain number of points if you agree exactly with them. They'll give you fewer points if you were close but not in exact agreement, and then no points if you were miles away from them. And so they'll come up with a numerical score, but they won't ever tell you what that score was. They just put them in these 4 bands. And in effect, what they mean is that band 1 means that you agreed with them most of the time. And band 4 means you hardly ever agreed with them. And obviously what you're aiming for is to get as high a band as possible. So it is different. It means that you don't get a numerical score, and therefore it can't be just bracketed with the other 3 to sort of, you know, rank order people in the same way that all the other tests can. And so it gets used differently by the medical schools and dental schools. The one thing that you can say with confidence is that band 4 is bad news. Most medical schools, and I think all of the dental schools, will immediately reject your application if you get band 4, regardless of how good you are at everything else. So avoiding band 4 is one massive target that you have to have. It doesn't happen very often. I think in the last 5 years it's happened twice, with all the students that we've had. So it's rare, but when it does happen, it's really tough. So because, instead of having 40 medical schools to choose from, you have about 5 that you can get into because they ignore the situational judgment test. So that's your immediate target, is not being terrible at this section. For most medical schools, so long as you're above that, it doesn't really matter whether you're in band 1 or band 3. So as long as you're okay at it, that's going to be good enough. But there are 1 or 2 which rate this section quite highly. So Nottingham and Lincoln, for example, they think that this is the most important part of the UCAT. And so they actually use this as a more important way of choosing who they're going to interview than all the other sections. So much so that it's almost impossible to get an interview unless you get band 1 at Nottingham and Lincoln. But that's very much an outlier. It's not normally like that. But the other reason it's worth aiming a bit higher than just avoiding band 4 is that all of the medical and dental schools tend to be a bit cagey about exactly how they make their final decisions following interviews. Because they say, well, it depends essentially on the score you get at interview. But then they say, if we need a tiebreaker, we might look at other things. And situational judgment is one of the things that they sometimes look at. So again, it's worth aiming high just because it might make a difference in your particular case. So in order to get good at it, I say what you need to do is to learn to think like this kind of idealized medical student that they want you to be. So one of the things that's worth thinking about before we plunge into looking at questions is medical ethics, because that's one of the things that sort of underlies the response you need to have to a lot of these questions. So in the sort of philosophy of medicine, and this applies equally to dentistry, there are these 4 pillars which have been around for years and years. You can see from what's on the board that medical ethicists love big words. If you look at a lot of the sort of online resources for how to prepare for medicine applications, they say, oh, these are the key words. You have to use these words all the time in your interview. That is nonsense. When you are interviewed, they want you to sound as natural as possible because they want to judge, are you going to be good at talking to patients? And sounding as natural as possible means you don't use words like non-maleficence. Okay, that's not natural. What's important is that you understand what these things mean so that you can think about them and talk about them, but in approachable language. So let's just go through them. So autonomy means that ultimately it's the patient that decides what treatment they get. Your job as a doctor or dentist is to advise them what would be best, or sometimes give them choices to decide between, but explain the advantages and disadvantages of each one. But in the end, they get to decide. And that's really important because sometimes, they can give you situations where you're going to feel like you ought to override that, but most of the time you can't. Having said that, there are exceptions. So can anybody think of a situation where the patient might not have autonomy? Yeah, so that's one obvious one. If they're in a coma, then obviously you can't wait till they wake up to ask them what life-saving treatment you're going to give them. So there's that one where they just literally can't make the decision for themselves. In that situation, it obviously depends on how urgent the treatment is. If it's emergency treatment, you as a clinical team have to make the decision. If it's not emergency, then you should consult the family. In the end, if there's lots of disagreement, you might even have to sort of get legal people involved. But that's in some ways the more straightforward, but there are other examples where autonomy doesn't apply or doesn't automatically apply. What if your patient is a child? What's the situation then, do you think? Yep. Yeah, essentially that's right, kind of. So up until you're 16, then your parents are essentially the people who make the decisions about what medical treatment you get. However, you can see that when you have teenagers, that can sometimes be quite complicated because, 14, 15-year-olds can be really quite grown up, well informed, perfectly capable of making decisions for themselves. And if they then disagree with the parents, you then have to ask the question, is it appropriate then to just completely disregard what the child wants if they appear to be grown up enough to make the decision for themselves? And that came to a head, it's probably about 20 years or so ago now, when a girl who was, I think, 13 went to her GP and asked for contraception and said, I don't want my parents to know. And the GP spent ages with her, sort of making sure she understood what all the issues were and what the risks were and everything, and also discussing that, there might be lots of advantages to sort of having her family involved and so on. But she was adamant she didn't want to do that. And in the end, the GP agreed to prescribe her contraception because the GP was convinced that she absolutely understood all the issues and that this was a really well-informed decision she was making. And then the mother found out and basically took the GP to court and tried to get him struck off the medical register. And the court sided with the doctor and said, well, because they hadn't just sort of said, yeah, fine, but had spent time making sure that the girl understood everything and was making a mature decision, then that was fine. And that's really changed things. So you get quite complicated situations now where you get teenagers who aren't old enough to be independent, but you might decide are competent to make their own decisions. So that sort of situation is unlikely to come up in a UCAT question, but is very much likely to come up in an interview question. And it's not that they expect you to know what the law is or what the history of the case law is or anything like that. It's just that they might ask you to think about, what's the right thing to do in this situation, do you think? And if you've thought about it ahead of time, it obviously makes that easier. So that's autonomy. Now, beneficence means just that you always do what's going to be best for your patient in terms of choosing what treatment you prescribe for them, but also just in general how you treat them. Whereas non-maleficence is the other side of that coin. Non-maleficence means that you don't do anything that's going to be harmful to your patient. So those two seem kind of obvious. You do things that are good for them, you don't do things that are bad for them. But what's the complication with that? Is it always easy to meet both of those criteria? Okay, so what would be a situation where it'd be quite hard to sort of say, I'm definitely ticking both those boxes? Okay, so think about cancer chemotherapy. Okay, cancer chemotherapy works by giving someone a drug which is going to kill their cells. And obviously what you're aiming to do is to primarily kill the tumor cells, but most anti-cancer drugs can't be that specific, so they will kill off lots of healthy cells as well, and therefore have serious, potentially sometimes almost life-threatening side effects. They can, for example, create new tumors in the future. So in that case, it's a call where you're saying, well, if we don't give this drug, the cancer's just going to get worse. But if we do give it, there are going to be bad things that happen as well as hopefully reducing the size of the tumour. So you can't neatly tick both boxes because you're deliberately giving someone a drug which is, making them ill in order to get rid of the cancer. So there are a lot, and that's kind of a fairly extreme example, but anytime you prescribe a drug, there's a risk that people just have unexpected side effects to drugs, that most people don't have, but this person might have. And you have to take that risk because, it's a small chance, or it may not even have been come across before, but it's there. So again, just being aware that although those two seem like obvious things, sometimes there's a difficult trade-off between them. Another good example is when you have a terminally ill patient who's in a lot of pain and you have to prescribe opioid drugs to control the pain, and it can get to the point where the amount of opioid that you're having to give is itself potentially, risking shortening the life of the patient. So then you sort of say, well, do I give less drug so that I'm sure that I'm not going to kill them with the opioid, but then leave them in pain? So again, it's a difficult situation. And it's something that when we get to the interview stage, you'll have to be ready to talk about. Justice is more straightforward, but also vaguer, but mainly it means things like equality of access to healthcare. In other words, you don't sort of say, right, well, I'll treat this person first because they're richer than you are, or something like that. So it's that's the sort of justice side of things. So as I say, don't think, oh, my priority is memorizing those words, but it's realizing that thinking about those things is likely to come in to questions that you'll have to answer. The other thing that's quite useful to do, and I think you should do this at quite an early stage of your sort of intensive preparation, is to read this document produced by the General Medical Council called Good Medical Practice. I think there's an equivalent document produced by the General Dental Council, but actually it says pretty much the same stuff in terms of this, so that this will do for everyone. And it's essentially a summary of the things that they expect of a professional working in healthcare in terms of the way they should behave. And it's, again, important, not that you can quote it chapter and verse to back up your positions. It's more that it highlights the kind of things that you need to be able to talk about. So these are some of the sort of things that emerge from it. So the first one is kind of obvious, that making sure your patient's welfare is looked after should come ahead of everything else. And in a lot of these UCAT situational judgment questions, that's what you need to keep thinking. When it says, how should you respond to this situation? If it involves the welfare of a patient, then you have to think about that ahead of everything else. Second one, though, you might sort of think, well, that seems reasonable, that you should obviously aim to be competent and keep up to date and things like that. But it may not be obvious to you just how important they consider that to be. So in particular, operating within your competence is massively important. That you should never do something that you haven't been trained to do. And because these UCAT questions tend to focus on, imagine you're a medical student and this happens or that happens, you have to remember that as a medical student, you're not actually officially competent to do very much because you're not qualified yet. So that issue comes up a lot, that you have to think, well, I can't do that, even though, I feel it's the right thing to do, but I can't do that because it's not my place to do it because I'm not yet qualified. And that comes up quite a lot. And the other thing is this professional knowledge and keeping skills up to date. What that means when you're a medical student is that you have to, go to all the lectures you're meant to go to, complete all the tasks you're meant to complete. And not doing that is considered to be a massively important dereliction of your sort of professional duty. So again, when you come up with issues in these questions which involve, for example, skipping a lecture for this reason or that reason, the answer is nearly always going to be no, you shouldn't do that. So there are some exceptions to that, but that's a really perhaps a more important one than you might have considered. Well, the third one, that's the patient safety thing again. But that means not just your own patients, but if you become aware of any other patient, if their safety is being compromised, then it's your duty to act, not just to say, well, it's not my responsibility. You have to sort of intervene anyway. Good partnerships with patients and colleagues. Well, the patient one is kind of obvious, but the colleagues one is important as well, because one of the things that they're really keen on is that you have to operate as part of a team once you're actually functioning as a doctor or a dentist. And that's not an easy thing to do. So teamwork is a big issue in interviews, and it comes up in these situational judgment questions as well. So don't forget, looking after your colleagues' welfare as well as the patient's is important. And then the last one is kind of sort of saying that, you know, you have to have integrity, not just when you're in the clinic dealing with your patients, but basically all the time. You can't sort of say, well, you know, so long as I do the right stuff with my patients in the hospital, I can go out shoplifting at the weekend, because that doesn't affect them. Okay, because it does, because if you are doing things like that, it's going to undermine trust in the profession. That's the idea. Okay, so those again are just things to have in mind when you're trying to train yourself to think like they want you to think, rather than necessarily how you might naturally think. That's the point, really. So let's look at these questions. First type then is an appropriateness question. So they give you a scenario and they'll suggest a particular response, and you have to decide which one of those best describes that response. Most of the time, though not always, it's fairly easy to decide whether it's appropriate or inappropriate. So in other words, you can narrow it down to either being one of the first two or one of the second two. But deciding between within those pairs can be quite difficult. So if you look at the appropriate ones, obviously they mean, yeah, that would be a reasonable thing to do. Appropriate but not ideal essentially means you could think of something that would be better. So there's nothing wrong with it, or nothing terribly wrong with it, but there is something better that you could do or say. And that might then be appropriate but not ideal. On the inappropriate side, inappropriate but not awful tends to mean that it doesn't sort of break any rules. You know, it's not sort of ethically or professionally unsound, but it isn't very effective either. Whereas inappropriate, very inappropriate, tends to mean that it actually is something you should not do as a student or doctor or whatever it is you're having to pretend to be. So it sounds like you can just, you know, use those definitions to decide which one it is. But what you'll probably find in practice is that it's quite difficult to sort of choose between a pair of adjacent ones in that list. And you'll also, even after you've seen what the model answer is, quite often you'll disagree with it. And that's just the way it is with this, because it is a subjective thing. And I've never sort of had a student who sort of got to the point where they said, yeah, I always nail these ones. You know, everyone always says, well, it's really frustrating because sometimes they just don't say things that I think are right. But so long as that's not happening most of the time, that's fine. So you've got to remember that this is kind of different than the other sections, where that you're just aiming to be not too far away from the way they think. Okay, so let's look at an example then. So remember, when you start looking at these, it's not necessarily about what you would actually do. It's about what you would do if you were this idealized medical student that they're getting you to think about. And also remember that good intentions count for nothing. So if one of these suggested actions is well-meaning, but actually won't have a good effect, then you have to say it's inappropriate. Okay, so just being well-meaning doesn't count for anything. So here's the first one. So there are going to be 5 questions based on this same scenario. So it's worth getting your head properly around the scenario. and then in the real thing rattling through the 5 questions. Okay. So, usually you can decide, first of all, is it appropriate or inappropriate, and then worry about the detail. So is it appropriate or inappropriate to say that? Any? Yeah, it seems reasonable, doesn't it? Because you think, well, that seems like good advice, really, doesn't it? If you learn the stuff better, then you're not so likely to get put in that position again. It seems reasonable. But is it very appropriate or is it not ideal? If you put yourself in the position of Aoife, the person who's had this upsetting experience, and your friend said to you, you should work a bit harder, would you be pleased? No, so it's not going to deal with the fact that she's really upset. Okay, just saying, well, work a bit harder, you're going to say, right, well, I won't say what you're going to say, but you're not going to feel particularly helped by that in the short term. So it's appropriate because it's sound advice as far as it goes, but it doesn't do anything to reassure and deal with the sort of immediate emotional situation. So that's likely, I think, to be a B. I should say on all of these that I'm quite likely to get them wrong because, as I say, you will do. Well, I mean, I do, and most people do some of the time. I think this is going to be a B. Yeah. Okay, so valid advice, but it doesn't deal with the fact that she's upset. So that's a good example of a B, really. That it's not wrong, but it doesn't. You can think of something better, and that's the way to think about a B kind of response. What about that one? Okay, so again, first of all, is it appropriate or inappropriate? Yeah, I mean, it feels kind of similar to the last one, really, doesn't it? In that it's uh, sensible advice. If you've got a problem with the fact that you didn't seem to be able to meet what this consultant expected of you, then talking to the consultant about it would be a reasonable way forward. But again, it's not really dealing with the fact that she's upset. So I would have said B, but let's see what they said. Yeah, so they said B again. However, if you read their rationale, I found that a bit weird. So I think the idea that it might make the consultant reflect on their questioning style, I thought that was a bit weird because there's no evidence that there was anything wrong with the consultant's questioning style. I mean, it didn't sort of say that the consultant had been unreasonably hostile or anything. So I thought that was a bit weird. So I sort of felt that I got the right answer for the wrong reason, according to them, that one. But you can see that one way or another, it doesn't seem like an ideal thing to say, but it's not wrong, so it's not going to be C or D. About that one. Yeah, so this is quite an important one because it introduces this mysterious figure, your supervisor. Um, it's important to know that throughout your training, you're going to have somebody who's a bit like your sort of personal tutor, I guess, who is the person that you can talk to about whatever issues you might have. And that's true not just as a student, but as a junior doctor or junior dentist as well. You'll always have a sort of mentor or something who should be seen as the person that you can talk to whenever you have problems of this kind. You can imagine in the real world that it varies hugely as to how effective that is. Um, some people will say, well, my supervisor doesn't know who I am and is always very keen to get rid of me and things when I go and see them. And others say, yeah, that, they're incredibly helpful. So it's in the real world, it's not clear whether that would be helpful advice or not. But remember, this is this ideal world. And in the ideal world, the supervisor is a really important person. And so that is going to be an A because they want you to think if something difficult has happened, going to talk to your supervisor is a great thing to do because they will be supportive and they have the wisdom and experience to really give you the best advice as to how to deal with it. So, that's why doing this kind of preparation is important because I don't think that would be obvious unless you knew that that was the way they viewed the world. But now you do. Anytime that kind of situation comes up, involving your supervisor is going to be seen as a good thing to do. Okay. Appropriate, inappropriate. Yeah, because yeah, I think it is inappropriate. Although, and you're right in a way that there's no evidence based on what we know, or presumably what Olivia knows, that the consultant was being unreasonable. So it may just not be right. Um, and but the other thing is that it's not providing any constructive advice. It is kind of, I suppose it's kind of, where the first two, I think, gave the constructive advice but didn't give the support. This one gives the support but doesn't give the constructive advice. But I think it's inappropriate because not giving constructive advice is a bad thing. So I suspect that's a C. Yeah. So it's not awful because it does have that supportive function, but it could actually be harmful if it's just making her think, oh, don't worry about it, because she probably should be doing something to try and get around it. Okay, and then I think there's one more on that. Yeah. So what do we think for that one? Well, is it appropriate or inappropriate, first of all? Yeah, I think it's appropriate, isn't it? Because, um, again, this is an ideal world. In the real world, medicine is full of completely unreasonable consultants. But in the ideal world, they're not. They're good, well balanced human beings who wouldn't rush to judgment based on what may have just been a single bad day or a single small gap in your knowledge or something. So that's fair comment, and it's obviously supportive. So it's an appropriate thing to say. But is it very appropriate or appropriate but not ideal? Well, I thought B because again it's supportive, but it doesn't really make any constructive suggestion. But they said A, and I'm not convinced it's not B, but and that's the thing. You're sometimes gonna read the answers, and as I say, all these answers that are given on there are the UCAT website's rationales that they provide. So it's not what I think or what some random site thinks. It's the official folk, and I think it's very hard to say that that's an A and not a B. But so long, if you said D, that's when you should be worrying. If you're miles away in what you think from what they think you should think, that's when you have to worry about it. If you just get in these grey areas wrong, then it's not a problem. Okay, so that's the first kind of question. The other kind is this importance sort of question. And say these are quite useful, not just because you have to do lots of them, but because when you talk about these issues in interview questions, it's important to talk about lots of things that you have to factor in coming to a decision. And so these are quite useful in that they make you think about the kinds of things that you might have to actually discuss in that context in coming to a conclusion about what's appropriate to do. So what they'll do is again give you a scenario, but this time they'll just suggest one of the issues that might inform your decision about how to react and ask you, is that particular issue very important, important-ish, or or whatever, down to not important at all. It's more difficult to say, with the other one, you could sort of say, well, it's either going to be one of the top two or one of the bottom two. I'm not sure that's as easy with these ones. Let's have a look at an example anyway. Then there'll be several questions from the same scenario, so it's worth reading it fairly carefully. So again, you can see if this was an interview question, I would have thought they would expect you to discuss, the alternative would be to sort of try to, given that Kim is your friend, the alternative you might think might be to get her out of the room and then sort of sort it out with her and make sure that she understood what the problem was, but not necessarily sort of dump her in the big trouble that she's going to be in. But it doesn't give you that option in UCAT because it just sort of says he needs to decide whether to report Kim's behaviour. So it's a bit different, I think, in a interview situation than in UCAT. But if you're just making this decision, does he report her or not? Is it important to factor in that she'll be in a lot of trouble? So what do you think? I want you to think for that one. Yep. Yeah, that's a D. Okay, at least I think that's a D. Yeah. So I mean, this, it is such a sort of bad violation of medical ethics for people to be sort of abusing the trust that the person who left their body to the medical school has placed in you. It's a massive abuse of that trust, and so they think it doesn't matter how much trouble they're going to be in, you have to report them. So again, you might think, yeah, but I would worry about that because they're my friend. But remember, this is an exercise. This is, you've got to train yourself to think like they think. You might end up thinking, well, I can't just ignore that, but you would if you were this idealized person. So that's why the practice is important. So you train yourself to do that. Okay, another one. So what do we think of that one? Yep. Very important. Okay, anybody agree, disagree? Now, interestingly, that I think is going to be a D again. So, okay, remember it happens sometimes. But if it happens once, it's okay. If it happens all the time, that's when you have to worry about it. So, but again, you know, what it comes down to is if you picture yourself actually in that situation, you're going to think, you know, that's my easy way out. I don't want to, you know, get my friend into trouble. So if someone else deals with it, that sort of gets me off the hook, which isn't. Oh, you mean? Oh, oh, as well. Oh, right. Okay. Well, yeah, I suppose that's slightly ambiguous in the question. Yeah, may report it, but I think the implication is so you don't have to. But yeah, I take your point that it's not a well, no, I don't think it's a particularly well written question. So I take your point really. But anyway, the general point that's important there is that you have to take responsibility for things and not just assume that someone else will deal with them. And that relates, for example, to that example thing we talked about before that when patient, I know this isn't patient safety because they're already dead, but it's kind of similar um, situation that it's not just your own patient that you have to take responsibility for. You have to take responsibility for anything that you see that's wrong. If it compromises patient safety, or in this case, if it just compromises your sort of professional ethics in general. Um, but you know, these answers are much more clear cut than I think you would feel if this was a real life scenario. And that's what you need to learn. Any thoughts on that one? Yeah, minor importance. So what was your thinking there? Yeah, I mean, I kind of thought I think that's kind of a trick question because what the scenario says is that they borrowed somebody else's ID so that they could sneak into the well, I didn't say sneak, but get into the dissecting room. So it seemed to me that they know that they're not meant to be there because they borrowed. So I think that it's not important at all because they clearly knew they were doing wrong. Um, I think if you can, you know, I can't really imagine a situation where, um, you know, someone could just sort of wander into a room like that and think, oh, hey, I should take some pictures. That's kind of cool. But, you know, that would be sort of different than someone deliberately cheating their way in there. So I suspect that's going to be not important at all because it's clear that they are there sort of fraudulently. You can see there are lots of D's in this section, but um, are they all equally bad? Shouldn't some be C's rather than D's? It's difficult, and you're not going to get them all right, and you shouldn't worry about that. Okay, so what do you think the required answer for this one is going to be? Yeah, this is going to be a D, and because they're going to say you have to put your professional duty before your personal concerns, so that's going to be another D. Um, but again, if this was in an interview, if all you said was that, I think they would think, oh, you're a very cold sort of person that you just dismiss your friendship kind of stuff. And I think that would be a bad sort of response in an interview because they'd expect you to say, oh, this is really difficult because, and then probably come down on that side in the end. But that's one thing that I dislike about this situational judgment question is that everything ends up being so sort of black and white and In reality, you're going to find it difficult to just dismiss that issue. But they're saying what you've got to do. So it's very instructive because you learn that you've got to be kind of hard line about your professional responsibilities and put it way ahead of everything else. As long as you know that, it makes life easier when you come on to more of these questions in the future. Okay, so one more scenario then. We're back to appropriateness in this question. And in this one, you have to ignore that Loki is a Norse god and just pretend that they're a normal medical student. Okay, so I kept this question to be the last one because I think this is quite a difficult set of questions, really. And which is another way of saying I got most of them wrong when I looked at it. So, but it is interesting because you've got several issues here that you've obviously got to take account of the fact that Loki is a medical student, not a qualified doctor, and therefore there are limits on what they're competent to do, what they're qualified to do or say, and they also obviously have to be aware of the fact that the doctor is competent and is sort of senior to them, but at the same time they still have a duty to help the patient out as much as they can. All of which doesn't make it very clear what most of the answers are. So any suggestions for that one? Let's see. So inappropriate because yes. Yeah, I mean that was my feeling. I sort of thought that because it's sort of yeah, so it's definitely trying to be supportive and reassuring. But the question is, are you sort of potentially putting the doctor in a difficult position and sort of going beyond your competence? So let's see what they said. So basically, they said exactly what you said, but came to decided on B rather than C. I haven't, you know, when you read the rationale, that doesn't sound like a B to me. It sounds like a C. And again, that's the thing that's frustrating about this. So it will annoy you. You don't want to do too much situational judgment on any one day, or you'll sort of end up tearing your hair out. But you do just get better at it, and there will still be some that annoy you, because I think that sounds like a good rationale for a C to me. But there you go. I think because it was reassuring, they said. But just remember that question because we're going to be a similar one in a minute, which has a different response. So it says, I will follow up with the doctor about what the next steps are for a formal diagnosis. Yeah, but this one is different. This one I think is more straightforward. To what do we think for that one? Yeah, yeah, that's definitely a D. You just have to put yourself in the patient's position to think about what you would think if the medical student said that to you. So it's obviously belittling their symptoms and suggesting that IBS isn't necessarily anything significant. And again, it's outside your competence. So for all kinds of reasons, that's a D. It's interesting, always in these questions, it says, assume that each of the following responses would be said politely. Sometimes it's kind of quite hard to imagine what they suggest being said politely. But yeah, that's a definite D, that one. But this is an interesting one. I will ask Dr. Nicholas if he can do any other tests. So if you compare that with the first one, which was, I will follow up with Dr. Nicholas about what the next step should be to get you a formal diagnosis. I thought, well, that's basically saying the same thing. But it's not the same answer. So anybody enlighten me as to why that's different? Yeah. But why is that different? Where was it? Hang on, I can't remember what it was. So why is this one less appropriate than that one? Right, so all of the tests came back normal. Okay. Yeah, I didn't think that necessarily implied that there weren't other tests, but I suppose potentially that could be the case. Yeah, I mean, I think you're right. That's what they said. So if you got that subtle distinction, then that's good. You're certainly ahead of me on that one. Because I thought it was basically the same thing. But as you say, I suppose if you're kind of interpreting that as meaning that the doctor had said he wasn't going to do any more tests, then you're right. But you can see how subtle it is. And the important thing, though, is that it clearly wasn't very inappropriate because it wasn't sort of massively undermining the doctor or anything like that. So long as you're there or thereabouts, you don't do badly, and that's what counts. That one. Yeah. So why is that? Yeah, I think that's right. I mean, essentially, it's giving medical advice, isn't it? Although it's very sort of bland medical advice, but it's essentially saying this is what you should do, and you're not in a position to do that. And it's also kind of dismissive, really, isn't it? Because it's kind of saying, well, as you are now, you're basically fine, even though the patient obviously doesn't feel fine. And it's just now basically saying, well, you are fine, and go away if you aren't, and only come back if things get worse. So I thought that was a D as well, but actually, you know, but again, when you read their rationale, it's fairly damning. So I could see why it might be a C, but why should that be a B if they've all these inappropriate things? It's frustrating, but you do get better at it, and that's the important thing. You're never going to get perfect agreement with them, but you get much better at getting close. And this is the last one. Yeah, the appropriate but not ideal. So it's appropriate. Why? Yeah, but the difference is that where the previous one was in a sense giving medical advice, I mean, albeit sort of fairly harmless medical advice, which is come back if you have more problems, but this one isn't. So in a sense, it's more acceptable, I think. But actually, this is an A. And the reason is quite interesting. If you read the thing, it says, this is an appropriate thing to say because it is empathetic. What does that mean? What's empathy? Yeah, so empathy is going to be, once we get on to interviews, which we'll do next, empathy is going to be one of the key words. It's one of their obsessions in recruiting both medics and dentists, is that you have to be able to put yourself in the patient's shoes and understand what they're feeling about things. And, you know, I think that, you know, if you put yourself in the patient's position, that statement almost sounds like a sort of brush off, really, doesn't it? I mean, I wouldn't sort of feel comforted and think, oh, they really understand me. If someone said that to me, I'd think, well, they're trying to get rid of me, you know. But you can see that just it's that as soon as you show evidence that you understand how they feel, even if it's in that, I would have thought, totally inadequate sentence, that's seen as a really good thing. So again, doing these things is incredibly useful, because you know that as soon as you say something which demonstrates empathy, or at least says that you're demonstrating empathy, even if it actually doesn't, that's going to be seen as a very appropriate thing to do. So ignore the advice just to write down what you actually think. You've got to learn to spot these things that they think are really important, and that will guide you most of the time towards the right general area, and that's going to be good enough. So don't get upset if you continue to get lots of them wrong right up to the exam, because you probably will. And I think quite often that's just because their responses are no more rational than yours are. But you're unlikely to be very far away if that's the case. Okay, so we'll stop there.